Director, Annette Rodriguez, will speak as well, providing you some medical information related to the COVID-19.
Después de que yo hable, la directora del Departamento de Salud Pública va a dar información.
Good, thank you. So I want to start by assuring our residents that the city and the county and our area medical professionals and other agency partners are working hard to slow the spread of the COVID-19 virus in our community.
Quiero comenzar asegurándole a los residentes que la ciudad, el condado y los profesionales médicos de nuestra área y otras agencias continúan trabajando juntas para poder así detener la propagación del COVID-19 en la comunidad.
Our goal and our effort is to save lives in our community while at the same time providing vital services and resources to the public.
Nuestros esfuerzos es para salvar vidas, para proveer servicios vitales y recursos al público.
One of those resources we developed, and we developed it yesterday, is a comprehensive tracking system of statistics for information pertaining to COVID-19.
Una de esas informaciones que vamos a tener va a ser un sistema de rastreo que se acaba de llevar a cabo y para poder tener esa información sobre el COVID-19.
And so each day now, Monday through Sunday, every day of the week, we will provide these statistics to the media and to the public.
Cada día de la semana, de lunes a domingo, vamos a estar proveyendo de esta información para los medios de comunicación y para el público.
And we're going to provide it in numerous formats, so it will be found on our COVID-19 webpage that both the city and the county share.
Se va a estar proveyendo por diferentes formatos, entre esos nuestro portal web.
We'll also place it on our, we'll release it to the media. We'll have it on our website. We'll also release it to the media each day.
Además de nuestro portal web, se le va a dar la información a los medios de comunicación.
And then we're providing it to other officials in the community, to include our city council, the county commissioners, including the judge, and as well our state and local delegation members.
Se les va a dar la información a otros oficiales del área, como los comisionados del condado, al concilio, entre otros.
And so I wanted to begin with what we have so far from yesterday. As of 4 o'clock, and the numbers and the tables, when they're updated at 4:30 every day, they will be as of 4 o'clock, and it will take the last 24 hours up till 4, and then we'll post them at 4:30 every day. So we did that yesterday, and these are the numbers I'm going to provide to you today that were as of yesterday at 4 o'clock, okay? So they include the number of cases, both new and total, in Nueces County. So yesterday in total, and since it was our first day of tracking, we put them all as new, but we have 10 cases of persons that have COVID-19 in Nueces County.
El número que tenemos total hasta este momento es de 10 personas quienes cuentan con el virus COVID-19.
And in Nueces County, there are 0 deaths related to COVID-19.
Hasta el momento ninguna persona ha fallecido debido al virus COVID-19.
Of the 10 cases, 7 are males and 3 are female.
De los 10 casos, 7 son varones y 3 son mujeres.
And of the 10 cases, the greatest majority is in the age range of 40 to 49 years of age.
La gran mayoría de las personas que se encuentran infectadas tienen una edad de 40 a 49 años.
Yeah, so of 10, 5 are in that range. There is one in the 20 to 29-year-old range, and then a few others, but that's a summary for that. Also, the number of tests that the health district performs in the lab, so not the number of persons tested, but the number of tests that were conducted to determine if a sample was positive or not. We'll be reporting on that. And yesterday, as of 4, we had tested a total of 24 persons in our labs.
El número de personas que han sido examinadas por el Departamento de Salud en total han sido 24.
Okay, so as a recap, this information will be provided every day at 4:30, and it'll be as of 4 o'clock the day prior.
Para sumarizar, esta información va a ponerse en nuestro sitio web a las 4:30 de la tarde y se va a cerrar esa información a las 4 de la tarde.
Okay, and I want to provide one other update that we would like to tell the community about because of COVID-19 and City Council's order to minimize group sizes. Yesterday, the City Council confirmed that order will go through April 17th.
El día de ayer durante nuestra junta se extendió la orden de no tener grupos mayores de 10 personas hasta el 17 de abril.
And the group sizes are no more than 50, but if we follow the CDC and the federal and state guidelines, is no more than 10 is kind of the rule. So no large group more than 50, but really shouldn't be any more than 10. As a result of that, the traditional Easter festivities that take place in an overnight fashion where people camp out at Levante and West Guth Park, we are going to cancel the ability to do that this year.
Desafortunadamente, y como estamos siguiendo todas las regulaciones federales, vamos a tener que cancelar la tradicional festividad que se lleva a cabo en el Parque West Guth, que se celebra normalmente durante el fin de semana de Pascua.
Yeah, so for this year, there's no camping on April 12th weekend, Easter weekend, at Levante and West Guth Park. That does also include any barbecue site usage for those parks. Okay, so with that, Annette Rodriguez, Director of Public Health, will now provide us an update on public health district participation in the laboratory response network for our region.
La directora del Departamento de Salud del Condado de Nueces y la ciudad de Corpus Christi nos va a dar la información más actualizada sobre la situación.
Thank you, City Manager Zanoni. We appreciate your direction and commitment to the City of Corpus Christi.
Gracias, administrador Peter Zanoni. Apreciamos la dirección que nos ha entregado y su trabajo que ha hecho para la ciudad de Corpus Christi.
As positive cases continue to increase, I want the community to know we will increase the number of residents being tested, which includes the possibility of doing more frequent drive-through events.
Mientras los casos positivos continúan incrementando, yo le quiero decir a la comunidad que vamos también a incrementar el número de residentes a quienes se le está llevando a cabo la prueba, la cual incluye la posibilidad de hacer más frecuentes las pruebas mientras estén adentro de su vehículo.
The drive-through testing has been very productive, and testing can be done on each patient in as little as 3 minutes.
Estas pruebas han sido muy productivas y cada prueba tarda alrededor de 3 minutos.
The drive-through testing limits exposure for our first responders, nurses, hospitals, doctors' offices, and the public.
Estas pruebas que se llevan a cabo dentro del vehículo limitan la exposición para nuestras personas de primeros auxilios, hospitales, oficinas de doctores y el público en general.
Residents are pre-screened through the phone bank at the health district for testing in order to maximize efficiency and utilize supplies and personnel as careful as possible.
A los residentes se les lleva a cabo unas preguntas antes de que se les haga la prueba para maximizar así la eficiencia y utilizar todos los materiales y personal que tenemos de la mejor manera posible.
We have over 45 people on the phones currently taking calls as quickly as possible. The phone number to the health district is 361-826-7200.
Tenemos alrededor de 45 personas quienes están contestando los teléfonos y están contestando lo más rápido posible. El número a llamar es el 361-826-7200.
The health district is also adding some additional physician resources. We have a doctor volunteering his time to assist in medical questions and are in the process of adding 2 additional doctors to our resources.
El Distrito de Salud también se encuentra obteniendo más recursos de otros doctores. Tenemos doctores voluntarios quienes nos están ayudando con las preguntas médicas y asistiendo y están en el proceso de poder obtener a 2 doctores adicionales como parte de sus recursos.
Monday was the first day our local lab was able to conduct testing locally. The Corpus Christi Nueces County Public Health District is part of the Laboratory Response Network, which there are 10 of them in Texas.
El día lunes fue el primer día en que pudimos utilizar nuestro laboratorio local para poder llevar a cabo las pruebas a nivel local y el laboratorio del Departamento de Salud del Condado de Nueces es parte de uno de los laboratorios del estado de Texas. El estado de Texas cuenta con 10 laboratorios para hacer estas pruebas.
As demands warrants, We will be processing at the health district for the 11-county region.
Mientras sigamos teniendo la solicitud de las personas, vamos a procesar pruebas para una región de 11 condados en nuestra área.
Again, I want to thank the city manager for his leadership with the health district.
Una vez más, le quiero agradecer al administrador de la ciudad por su liderazgo con el Departamento de Salud.
Okay, great. Thank you, Annette. So that concludes our prepared remarks for this afternoon. This is an opportunity for a dialogue with the media, so if there's any questions, we'd be glad to answer those.
I have a question, sir. Do you guys know what cities
We do, and I don't know if we have them with us here today. Okay, we don't have them. We don't have that material here with us. But the majority are obviously within Corpus Christi. We will be trying to, as we get the data, report that out to the media and the community. When we're getting test results from a private lab, that it's tougher to get information. When we conduct the test, we have more patient information. But when a private lab is doing them, or a commercial lab as they call them, it's we don't always have quick access to that type of information. So hence, that's why we don't have it today.
do we know if the three individuals recently, were they travel related or were they community spread?
I believe all the three were travel related. Yeah, all of our cases so far, there's been 10 that have tested positive. All of those were travel related.
That you were gonna keep up
Yeah,
Can you explain a little bit more about
yeah. Let me have sure. Annette talked about that a little bit and how you tell the community.
Sure. So when you're doing the contact tracing, you're asking them to go back 14 days if they can recall. So looking at credit card statements, so to jog their memory. And some of those times you'll see that they've gone to a local mall or they've gone to a grocery store. And so we've actually jotted those down. We have that information. But at this time, we just need the community to know, because we're doing all the social distancing, the better way to do this is just to actually social distance the 6 feet from other people. That's going to be your best effort than trying to be very specific with on this day at this time. I think it's just going to convolute things because, again, we have a lot of 10 individuals, which actually have a lot of contacts to those individuals. So there's a lot of different places that they've actually gone to. So if we follow the social distancing of 6 feet, washing our hands frequently, cleaning those frequently touched areas, we're going to be much better off.
Do you know if there's any other
No, I think anywhere where you're in real close contact with people, you need to avoid. Of course, people that need hospitalizations need to go to the hospitals and get the medical attention that they need. So I'm not saying not to go to those places, but you just need to make sure that wherever you're at, that 6 foot distance is there between you and the other person.
Questions. Any plans at all to reopen Memorial Hospital and maybe make that a flu center and move those patients to Memorial Hospital and have it worked out of there instead of simply having the testing done outside, open the building up?
We've talked about a lot of different venues that it could be. We've seen people triage actually in parking lots. So there's a lot of different places that you can actually do this and do it well. It could be in a tent area, off-site of your hospital. So any specific at this point, I do not have that information.
Any idea about asking retired doctors?
Absolutely. We've already reached out to some, retired individuals, and like we said, we do have a physician that's retired that's actually working with us to help answer some of those medical questions, but we're also looking at retired nurses as well.
And back to your drive-through, I heard that the National Guard is supposed to come down to Kingsville over the next few days to help with their drive-through testing. Is the National Guard or any other agency that you know of help us out, and have y'all requested it?
The governor allowed that provision, and we have not needed that at this time, so we have enough city resources. Thank you to the city. Also, Krista Spahn, that is their the previous Memorial Hospital location. So at this time, we do not need that additional resource, but at any time, if we do need it, we know that it's available.
And we're apparently not going to a shelter-in-place. I thought the shelter-in-place would be a good idea. It's more of a stay-at-home type thing. Do you still urge it to be changed to a shelter-in-place order versus this stay-at-home, and what do you think the
You know, whether you have a declaration or not, our message has been the same. If you are not an essential employee and you don't have to be outside of your home, it is actually best if you stay home, especially for the vulnerable population, the elderly, those that are recently pregnant. There's a lot of vulnerable populations, immune compromised, that need to actually be staying at home.
And was there any disagreement or arguments about who was gonna get shut down and who was gonna stay open? And that's why we went to a stay-at-home instead of
No, I haven't had any arguments with people. I mean, if I'm arguing anything, it's people should stay at home. So, but I understand hospitals have to continue. We wouldn't want it any other way. There's a lot of essential organizations, companies that we need. You know, I've heard HEBs and grocery stores being criticized for having more than the 10 people, and that's very disappointing to me because they're actually a source of essential needs for our community. And so we need groceries, we need toiletry, we need all of those things that they provide. And so I really want to say thank you to all of them that are actually out in the front lines and serving our community well.
And at the hospitals, are they having elective surgery still? Are they keeping those doctors and those patients completely away with anyone who has
You know, that's a great question. I don't really have the specifics on that. I did see that the governor said that it is time to cut out all non-essential surgeries. So that would be a question you'd have to ask the hospital, but I believe they're all working towards that end.
Do we have any updates on the second drive-through testing?
The second drive-through will be this Thursday, the 26th, and it will be at 7 a.m. So at the same place, at the Old Memorial Hospital parking lot.
How many of the testing have,
How many nonprofit?
no, out of the testing who have been done privately? Ever resulted positive?
I believe that number is 4, but it could be 3.
So then, in the city total, we have 14, or is it just 10 at this point?
No, it's 10. It's a total of 10.
That's including the private.
Right, exactly.
Okay, any other quick questions?
I know there's a lot of misinformation.
Right.
Is there a reason these two conferences are separate and moving forward?
Well, we do, so we are working closely with the county, and we have been since day one. Judge Canales is the county judge, and the commissioner's court is a separate building, and so the judge is gonna have a press event today at 4. We're gonna do one here every day at 3, just so the media knows every day at 3, come here. We don't wanna, we're trying to keep some consistency. So there may be other events around the 3 o'clock. There could be a 2 o'clock, there could be a 4 o'clock, there could be a 6 o'clock. What we want you to know is every day at 3, we're gonna have something here, and mostly it'll be on public health update from the health department. Today, Judge Canales also wanted to have, on top of this one, her press conference at 4 o'clock to talk about the stay-at-home order. And so that'll be across the street. We are coordinating with her, though, and that's all I can say on that.
I do have one question. It's the last one here. I understand that Robson recently announced a positive case for the county. Is that something that's still part of the 10?
Yes, it's still part of the 10, because we do for the whole region, in fact, for a multi-county region. Yep. Well, Annette told you already, but you might be, it's worth repeating again.
So what public health does is contact tracing. So we would get in touch with the individuals that that positive came in contact with. And for those individuals that had direct contact with them, we put them in a 14-day quarantine just to make sure they stay asymptomatic before going back into the work environment. I don't have that information. I was just responding to the question.
Okay, good. Any other questions then? So today is Wednesday. We'll be back here tomorrow, Thursday, and then later today at 4:30 we'll have an update on our numbers that'll be posted on our website and made available to the media. Thank you for being here. Thanks for your questions as well.